All right. So I'm going to do a very brief presentation. Give me one second. Yes, a very brief presentation on supporting the emotional, behavioral, and mental health needs of special needs children. And in this presentation, I'm going to go over the relationship between the special needs population and mental health, special populations and social emotional skills, and lastly, the emotional support needed for parents that have children with disabilities. So in 2000, when it comes to mental health, in 2014 and 2015, they noticed that there was an increase among those with special needs, more specifically autism, that there were higher rates of psychiatric disorders being diagnosed in comparison to the general population, those that do not have special needs. And so we were seeing an increase in anxiety disorders, ADHD, obsessive compulsive disorders, depression, and also mood disorders. I'm just going to move this out of the way so you guys can see the whole slide. And of course, if you have an increase in the diagnosis, you also have an increase in the rates of psychotropic medication for our kids. So you're going to have children with special needs who are taking one or more medications per day. And so you ask yourself, why is this occurring? Why does there seem to be an increase in the psychiatric disorders among our special needs children? Well, of course, we talk about genetics, but then if you look at this list that I have here of the difficulties that our children face on a daily basis due to their special needs, you would understand that the difficulty of them maintaining relationships, creating relationships, friendships, and also if they're having problems with hygiene, they might be rejected. And also if they do not have self-control over their maladaptive behaviors, they may also feel rejected as well. So our kids are more prone to feelings of anxiety, loneliness, isolation, depression, rejection, and other feelings. Unfortunately, almost for the older population, even suicide, unfortunately. And now that we're talking about mental health services for our kids with special needs, what do the parents face when they're trying to advocate for their child to get mental health services in healthcare? Right? What are the challenges? Well, I will say this, not only in the mental health department, but also in the primary care department, health department, that most of our care, well, I'll say some healthcare providers are not trained to provide services to the special needs population. For example, in the general population, when you're trying to diagnose a child or individual, you're doing interviews, questionnaires. But when we come to the special needs population, if they're having issues with the verbal language, impaired cognitive abilities, and maladaptive behaviors that make it difficult for the healthcare providers to actually get a real good understanding of the symptoms and be able to diagnose. I mean, sure, they have observations and sure they have reports from the caregivers, but sometimes it's not accurate. So you might have an increase of a misdiagnosis for our kids. And so, and when you look at the aged out individuals, we're talking about the individuals with special needs who are 21, they're out of school, or 25, or they have ran out of their health insurance coverage. You have a lack of access to facilities that provide mental health services for the special needs population. We also have a lack of access to health insurance coverage and also the inability to pay for services. So with all of these issues that the parent is facing to advocate for their child to get mental health services, what is the solution? The solution is this. We need more healthcare research that includes the special needs population. We need new diagnostic tools for the special needs population. We need more awareness and more training for behavioral health professionals and primary care professionals. And lastly, we also need parents to continue to advocate not just for their children in the realm of education, but also in healthcare itself. Here is an example of what most healthcare workers are trying to improve: patience, empathy, anticipate the individualized needs of the patient with accommodations. They need to accommodate your child. And I have a lot of horror stories about that. They need resources that they can refer you to special people who specialize in the population. And they need, most importantly, to listen. Right. So now that we talked about mental health, we're going to go into the meat of it, which is the social emotional skills that are needed for our kids to succeed. The definition is social emotional skills are the child's ability to identify and also to appropriately respond to the emotions of others. Due to the time restraints, If there's any further time later on, I can explain how each of these basic skills can be taught, but I will just go over it briefly. Your child should learn how to label the emotions of themselves and others. They should be able to explain why they feel the way that they feel. Number 3, they should learn how to show empathy towards others, and that's pretty tricky, but it is possible. Number 4, they should learn to express their emotions without engaging in inappropriate behaviors. That means coping skills. Number 5, they should have an appropriate level of interest in other people's actions and belongings, or, show some type of level of enthusiasm over someone else's positive behaviors. And lastly, number 6, they should be able to anticipate how a peer might react to their behaviors, or learn to avoid certain behaviors that might elicit negative reactions from others. So that's what we come from, where it comes from, the perspective taking skill. All right, and we always talk about the child, but we never talk about the parents. And I heard it mentioned earlier by Ms. Grimes about, the parents need help too as well. So what do you think the parents are going through? Well, we've noticed through research that parents who have special needs children are prone to chronic depression and anxiety. So they have the social and economic concerns. They have the financial burden, the changes in their families due to the special needs of their child, and also the insecurity of long-term caregiving. That indicates that when the child becomes older, they're now grown children, what's the next step? They need some assistance in navigating the system, the healthcare system. And so healthcare providers need to understand and really be sensitive to the emotional concerns that parents have, especially as they're going through the stages of adjustment or lifetime of care. So the stages of adjustment starts with the diagnosis, of course, and of course you go through the process of grieving at the same time. There is the diagnosis, and then so you feel angry, you feel first denial, then anger, then you're trying to fix the problem, and so forth. And we need our healthcare providers to be assisting our parents through every stage of adjustment. So here are some of the suggestions that they have from research. Social supports are very important. Support groups for couple relationships and single parents, which include learning coping strategies as well as stress management. We need to promote family cohesion. That means that all the families should be working together for this child that has special needs. I'm asking the parents to be willing to be flexible and open to trying new strategies that are suggested by your service providers. If it doesn't work, at least try it. And also the importance of parent decision-making should be encouraged. The parent should be deeply involved in the treatment and deeply involved in making decisions. And also the healthcare provider should be sensitive to the culture and the background of that family. And lastly, we have behavior interventions. If we have enough time, if you want to take a picture of this very quickly or a screenshot, here are some places where you can actually have for your child to learn social, emotional skills. For those that have no problem sitting down to read books, I have some books here. For those that are more into interactive things, the first one is actually an app that teaches social skills. These are the references that I've used. And I just want to thank you for this opportunity. I'm super excited, and I hope that this was helpful.